I want to talk about the use of restraints in ICU patients. Also, don't mind my coffee stain. I just did this. I'm not changing for that. We use restraints quite a bit in the ICU. I would say more so than a lot of other areas of the hospital, minus like the ER, in order to prevent patients from pulling out their medical equipment too prematurely. This type of restraint is called a soft restraint, and it's kind of foamy. It actually has like this little Velcro and buckle, and then you tie it to a non-moving part of the bed. Now, before I jump into too many details, make sure whatever hospital you're working at, you follow their policy for restraints. Despite whatever you're hearing in this video, I have noticed that every hospital has slightly different policies on restraints, so just make sure you're checking it out. Whenever we are restraining patients, we want to make sure we're doing it safely and appropriately. We want to make sure that they're not too tight to where they're cutting off any, perfusion to the patient's hand. They're not breaking the patient's skin down. We also want to make sure we are not unnecessarily restraining people. There are some nurses that are like, I restrain all of my vented patients no matter what. And there's some nurses that are kind of like, I try not to restrain people unless I need to. And I kind of veer more towards that side because I think it can be very traumatizing for patients to be restrained, especially when it's not necessary. You have to think a lot of patients in the ICU are on ventilators. They have all this equipment going into them. They are strapped down to the bed. They may have some sedation, so they're confused as to what's going on. They've got a tube down their throat. It can be very, very traumatizing, and a lot of patients can end up with actually PTSD from their stay in the ICU or in the hospital because of things like this. This is another type of restraint. So this isn't actually considered a restraint at my hospital. We don't have to chart on it like actual restraints, but this is a mitt, and these are really great, like a great alternative for patients so you don't have to restrain them because they can't necessarily grab super easily, especially like in your elderly patients that are maybe a little bit weaker, but it prevents them from being able to reach up and grab their breathing tube. However, I will say these can be wonderful, but also I've seen patients try to bite them off. Sometimes they can actually pull them off like this, or if they're strong enough, their hand can kind of grip through them. So just be careful. It's also important to note that patients that are wearing BiPAPs usually at most hospitals are not allowed to be restrained because if they were to vomit or something like that, they need to be able to pull their BiPAP mask off. And if they can't, then they're going to be potentially aspirating. This is another type of restraint. This is a locked restraint, or also known as a violent restraint at my hospital. It is quite literally locked. These are for your patients that are super violent, either towards themselves or other people, and these are a temporary measure until we can get patients medicated appropriately and calm down in like a better, safer headspace. The last thing I want to say is whenever you're restraining patients, I always try to talk to them about what's going on and just try to educate them, so that way hopefully it helps prevent some of the trauma that can come along with being restrained. And that's my 2 cents on restraints.